The Western medicine paradigm for atherosclerosis is cholesterol. Is cholesterol really our friend, or is it the foe, the enemy that they're creating it to be? Pharmaceutical companies want us to believe it's this, and I'm going to try to get you to understand that it's this. Because this is the whole reason why they're using the particular protocols that they have. They believe when you go in to get your blood checked, you get a total cholesterol, you get an HDL, an LDL, and a VLDL, and then you get slapped on a drug if it's out of range. I see it all the time. And I'll say, well, do you have the other risk factors involved? And they say, well, what other risk factors? Cholesterol does not cause cardiovascular disease. Okay, so what does cholesterol actually do then? If I'm saying cholesterol is not the cause, then what is the cause? Well, let's talk about, first off, what cholesterol actually does. Okay? Cholesterol is a fat substance that's mainly made in the liver. 80% comes from the liver and 20% comes from our diet. I'm going to repeat that. 80% comes from our liver and 20% comes from our diet. So if you go in and you go on a low-fat diet, guess what's going to happen? Your liver is going to start making more fat. Because if you require cholesterol for one of the many things that it does in our body, your liver is going to automatically start increasing cholesterol production. We need cholesterol. It's not an enemy that goes around and searches around and goes, oh, I'm going to create atherosclerosis. That's not what it does. That's not how it works. High cholesterol is not the cause of cardiovascular disease, period, end of sentence. It doesn't cause cardiovascular. That's downstream thinking. When you look at a patient that has had a heart attack or has had a stroke, and you go, oh, yep, they had atherosclerosis and plaquing in their vessels, and they'll say, you know, it's made up of cholesterol. Yes, it's made up of cholesterol, but why was the cholesterol there? That's the question I'm going to answer for you tonight. And so this particular process, the reason I have this photograph up here, is that here's where the statin drugs work and here's where cholesterol is made. This is what happens when we make cholesterol. So the primary function in cholesterol production is inside the liver. Who's been told in this room that LDLs, and I should have put VLDLs on here, are the bad cholesterol and HDLs are the good cholesterol? Who's been told that? Anybody? Everybody in the room raised their hand. Okay, the problem is that the LDLs and the HDLs are not different. They're not different forms of fat. One's not good and one's bad. It's where they are in your system. Okay, so LDLs and VLDLs are a protein that carry fat from the liver out to the periphery, to your brain, to your adrenal glands, to anywhere in the body that it needs it. Do your vessels need it? Maybe. Maybe there's inflammation on the vessels. Maybe there's homocysteine and trauma and toxicity on the vessels. Cholesterol is an anti-inflammatory. Cholesterol is an anti-inflammatory. And I call it the Kmart version of anti-inflammatory. It's a cheap anti-inflammatory the body makes. It's what it has to do. Okay? So LDLs and VLDLs are not good or bad. They're where they're transporting. It's like a FedEx truck. It picks up the cholesterol from the liver and it drives it off to wherever it needs to go. Okay? And HDLs are not good or bad. They're transporting what's left over out there in the periphery back to the liver for recycling. So there's not difference between these. These are not different forms of fat. These fats are exactly the same. It's what truck you're in. Are you in the truck going out or coming in? And so they say if you have more going out than you have coming in, you're at risk for cardiovascular disease. And I'm going to tell you that's not true.